Caraga, Contra COVID-19, bringing you the updates of the Corona Infectious Disease 2019. Maayong adlaw, Caraga Region, ug sa mga gasubay online. Kini nga programa giuluhan sa Department of Health, Caraga.
Maayong adlaw. Ani ana sabta karon sa programang Caraga Contra COVID-19. Last April 6, 2020, atong gisibya sa mga katawan atong first confirmed case in our region. O karong adlaw, akong giyawhag atong Regional Director Jose Aliacuna Jr. para sa paghatag sa Caraga Situational Report, updates ug dugang announcement.
Maayong adlaw, Caraga. Greetings of peace and good health. On the national scene, we have 3,764 confirmed COVID-19 positive cases, 84 recoveries, and deaths of 177. In Caraga region, since the start of our monitoring, duna natay 51 ka patients under investigation, 39 are being cleared, giving us the present status of 12 PUIs, 4 admitted in the different facilities, while 8 are on home quarantine. On April 6, mga kaigsunan kung mahinumduman nato, we reported a positive COVID case in Caraga. And following directives, we start on contact tracing. We categorize our contacts into two. Category A, ang co-passengers sa maong pasyente on March 12, 2020, and Category C, ang immediate members of the family. Category A is 35. 35 ka-passengers ang kauban niya based on guidelines. And out of this, 30 were already contacted. We were able to secure the information that they have completed the home quarantine with negative signs and symptoms referable to the respiratory tract such as fever, cough, sore throat, and colds. Sa category 6, C, siyam ka-immediate members of the household three of whom are being tested for rapid antibody testing ug 5 for testing within the day. Ang usa atong gikwaan og swab including the antibody testing.
Thank you, Director Lecuna. O karon, aniya sa pikas linya, atong bisita gikan sa Department of Interior and Local Government, Assistant Regional Director Engineer Donald A. Saronay para sa paghatag sa mga lakang nga ilang gibuhat bahin sa COVID-19.
Mayong adlaw sa atong mga suking tigpaminaw atong mga netizens diri sa tibuok Caraga region. Ako lang gusto ipaambit kaninyo ang updates gikan sa atong opisina sa DILG Region 13 in the light sa atong COVID crisis nato karon, no? So ang atong buhatan sa DILG, we have a 24 hours regional emergency operation center. In other words, doon na kita report nga ipadangat nga to sa kauluhan upat kabisi sa usa ka adlaw, no? Alas 6 sa buntag, alas 12 sa udto, alas 6 sa hapon, alas 12 sa tungang gabi. Para ato pong ma-cater po ang mga clarifications o assistance nato mato sa atong katawhan o sa atong local government units. Kita sa we are acting sa mga sumbong o sa mga several concerns nga gipadangat ka nato pinagi sa hotline nato o iyon masab sa social media o iyon masabikan sa atong mga field offices sa tibuok rehiyon. Ang atong opisina nagamonitor sa compliance sa local government to the national directives and preparedness measures for this COVID-19 crisis. Mahitungod sa implementasyon sa atong social amelioration program and other programs, projects, and activities in relation to COVID-19, ang atong opisina nag-aauhag sa atong local governments within their responsibility pagpa-fast track sa identification of target beneficiaries of the social amelioration program as enumerated sa GMC number 1 series of 2020. And mas maayo prompt ang ilang submission sa listahan sa mga beneficiaries ngadto sa Department of Social Welfare and Development and other concerned national government agencies. Itong mahibuluan, particularly kinini ang sa DSWD, doon sila listahanan that needs to be validated by the local governments. So the faster nga masubmit nagbalik ngadto sa DSWD, mas paspas usab ang pag-release unya nining atong social amelioration program. Dili lang sa DSWD, doon na say programa ang atong Department of Labor and Employment, ang atong Department of Agriculture. So naasab siya nga similar nga mga separate nga mga programa under the umbrella of Social Amelioration Program. Sa pagkakaroon, istriktong atong pagmonitor sa updates nato sa atong local government unit, mahitungod ni niya. Doon na kita online monitoring system para sa atong 24-hour man regional emergency operation center. Mahitungod sa issue sa provision of temporary economic relief to individuals and businesses in LGUs under community quarantine. This is being provided for under the ILG advisory dated April 2, 2020. Ang nahilatin nining maong issuance to adopt suggested fast-track measures prescribed by ARTA or kinigintawag na itong Anti-Red Tape Authority as contained in the advisory number 1 dated March 25, 2020. This is being issued in cognizance to the need to ensure unhampered delivery of government services despite constraints imposed by community quarantine measures or sa pagkakaroon enhanced community quarantine ang tibuok Caraga region, such as item number 1, emergency extensions. But pasabot din niya, if the situation so requires and without prejudice to existing laws, the LGU exercise discretion in the emergency extension of validity of LGU licenses, permits, and clearances. Certifications or authorizations that are expiring within the period of the state of national emergency. Particularly kat ganing mga lisensya, whose application for renewal or extension may not be filed tungod sa mga panghitabo karon. Or pending approval due to the quarantine impositions. Item number 2, as much as possible, allow the use of electronic submission and approvals through the use of email and online platforms. So, pinaagin lang sa internet ang pamaagin niya. Item number 3, as much as possible, isuspend ang notarization requirements for the submission of documents to be submitted unless otherwise clearly required by law. Item number 4, reduction of requirements and signatories. So, ang processing of incomplete application subject to completion after a designated period or when conditions normalize, pagkahumanin ni atong crisis karon, the use of electronic signatures or pre-signed license clearance, permit certification or authorization with adequate security and control mechanism may be allowed. And lastly, to employ online payments, no? Ginagamit man ni kasagaran sa atong bangko. So for payments of prescribed processing fees, the government agency, whenever applicable, may employ an online payment scheme or outsourced payment collection centers for the transacting public para mas convenient sa atong katawan. Another item is to relax the imposition of fines and extend as may be deemed feasible statutory deadlines and timelines for payment, among others, atong RPT, Real Property Tax, Business Tax, as well as payment of taxes, fees, and other charges set by law or pinaagi sa ordinansa sa atong local nga pagamahanan due and debatable within the first quarter of 2020. Item number 3, provide incentives or privilege to taxpayers and business establishments, particularly those extending assistance during the COVID-19 crisis, in line with ordinances that have been or may be issued pursuant to Section 22 of Republic Act 7160 and other applicable laws and policies. Item number 4, mobilize the LPCC or kiningitaw na to, Local Price Coordinating Council, to the extent possible, and to monitor price increase of basic and prime commodities through the conduct of inspections in public and private markets, deputation of barangay officials and non-government organizations to monitor excessive and unreasonable price increase in order to forestall or deter such opportunistic actions. So kinahanglan atong paligunon ang atong Local Price Coordinating Council. Another item is to extend relief or grant assistance, whether monetary or in kind, to ease the burden sa atong mga kaigsonan that may be adversely affected by the community quarantine consistent with the guidelines stipulated under the ILG Memorandum Circular 2020-065 dated March 30, 2020 regarding the guidelines for LGUs in the provision of social amelioration measures by the national government for the most affected residents of the areas under enhanced quarantine, community quarantine. Another item nga gusto nato ipahibalo sa atong katawhan is kining postponement of administrative activities during enhanced community quarantine and state of national emergency. Atong giauhag ang atong mga local governments to postpone all demolition and eviction activities and ensure that all homeless citizens within the respective jurisdictions are properly accommodated pursuant to the memorandum issued by DILG, no? DILG Memorandum Circular 2020-068 dated April 2, 2020 relative to the postponement of all administrative activities during the ECQ and state of national emergency. Another item nga gusto sa nato ipahibalo sa itong katawhan, kini ang DILG Memorandum Circular 2020-063 dated March 27, 2020 mahitungod sa interim guidelines on the management of human remains for patient under PUI or patient under investigation and confirmed coronavirus disease 2019 COVID-2019 cases. As lead agency of the management of the dead and missing or MDM, we have been directing the local governments to organize and convene their respective MDM cluster team. Ang ato opisina nag-auhag and closely monitor the compliance of LGUs to have a list of funeral parlors, crematoriums, including the availability of Muslim funeral facility. By this time, ang atong mga local government units shall already have prepositioned their cadaver bags for human remains for the eventuality of deaths. Lastly, ang ato sang gusto ipahibalo sa itong katawhan, kinini ang Memorandum Circular sa DILG 2020-064 dated March 29, 2020 mahitungod sa Provincial, City, Municipal Special Care Facility and Isolation Units amid the COVID-19 pandemic. Right now, ang DILG has already conducted an inventory of quarantine and isolation facilities for PUIs and those positive COVID-19 cases with mild symptoms or asymptomatic, and special care facilities for severe cases of COVID-19 patients. Doon ay mga pangutana sa atong mga kaisunan kung doon na ba'y sanction kada individual nga dili mo sunod sa executive order sa atong gobernador, sa atong mayor, or sa atong mayor mahitungod sa community quarantine. O sa pagkakaroon, enhanced community quarantine naman ang atong tibuok Caraga region. So ang atong tubag niya nang sanctions to people who will violate the executive order on enhanced community quarantine will depend on the provision of the executive issuance or the applicable local ordinance. It may be a penalty or fine or imprisonment or both. People who will not follow the orders of the duly constituted authority or person in authority and the agents of such person can be charged under pertinent provisions of the revised Penal Code, either Article 151, which refers to resistance and disobedience to a person in authority or the agents of such person, or Article 148, which refers to the direct assault as the case may be. Mahitungod sa atong mga PUM or PUIs who will not cooperate with the officials nato sa atong local nga pagamhanan or persons in authority can also be charged under Republic Act 11332 or the mandatory reporting of notifiable diseases and health events of Public Health Concern Act, particularly Section 9, the prohibited acts thereof, which refers to any person or entity found to have violated Section 9 of this Act shall be penalized with a fine of not less than 20,000 pesos but not more than 50,000 pesos, or imprisonment of not less than 1 month but not more than 6 months, or both such fine and imprisonment at the discretion of the proper court. For uncooperative PUMs and PUIs, the BHERTs can request the TANOD for assistance to oblige these uncooperative persons under monitoring and persons under investigation to stay in quarantine and follow the instructions of the health workers. Atong mahinumduman nga ang atong TANOD membro sa atong barangay health emergency response teams or atong BHERTs. In extreme cases, the BHERTs can coordinate with the local COVID task force to request for police assistance to compel uncooperative PUMs and PUIs to follow proper protocols. Atong may numduman nga atong city or municipal chief of police is a member of the local COVID task force. Now, basig doon na sa mga pangutana unsa may sanctions sa atong local governments nga dili mo implementar sa mga issuances nga gipadangat sa atong buhatan or sa DILG. Failure of the local government unit to comply with the directive of the DILG will result to the issuance by the DILG of a show cause order to the local chief executive as a matter of due process. If a probable cause is found, administrative case for dereliction of duty may be filed before the office of the Ombudsman. So, daghang salamat sa atong mga kaigsunan nga padayon nga nag-monitor sa atong extensive implementation sa atong rehiyon sa COVID-19 nga crisis nga atong itabang karon.
Daghang salamat, Engineer Soronay of DILG. Looking forward for strengthened partnership and collaboration. Sa mga makausab, among gipahinumduman ang tanan nga maminaw lamang kita sa mga opisyal na balita. Kung aduna mo'y mga pangutana, text or tawag sa mga DOH hotline numbers. DOH Caraga hotline numbers 817-6546, 0945-359-2632, and 0948-224-1857. For mental health and psychosocial support services through telecounseling for Caraga State University, adunay pipila ka mga numero na pwede tawagan depende sa oras. For National Center for Mental Health Crisis Hotline, kindly dial the following numbers. For Agusan del Norte, Agusan del Sur, Surigao del Norte, Surigao del Sur, Province of Dinagat Islands. For DOH official Facebook page, kindly like DOH Center for Health Development Caraga. Before we end this program, may I call in again our Regional Director for his closing message.
In the course of our contact tracing, my friends, it has come to our attention that some documents, like a passenger manifesto, has been posted and circulated in the social media. This office, CHD Center for Health Development Caraga, denies the release of such document. We are aware that all acquired sensitive information, especially contact tracing procedures and information, is confidential, for which reason we safeguard this information. We appeal to the public to be prudent and responsible in sharing and verified and sensitive information from unknown sources. We have coordinated with the regional PNP for their swift, appropriate action. We also informed the regional task force, One Caraga Shield, of this information and appropriate actions. Mga kaigsuunan, sa pagtambal sa atong mga pasyente, adunay mga guidelines nga atong gihatag sa atong mga doktor. Ang designated nga COVID-19 hospital nga mao ang atong DOH hospitals, Caraga Regional Hospital o Adela Serra T Memorial Medical Center, maoy mutambal sa severe acute respiratory infection or SARI. Sa mga mild o moderate nga infection, this will be handled by our level 1, level 2 government facilities. Dinhi sa Butuan, ang Butuan Medical Center. Sa Agusan del Norte, ang Nasipit District Hospital administered by the Agusan del Norte Provincial Hospital. Sa Agusan del Sur, ang Dio Plaza Memorial Hospital. Dito sa Surigao del Sur, ang Bislig, Madrid ug Lianga District Hospitals. Ug dito sa Surigao del Norte, ang Surigao del Norte Provincial Hospitals. Sa katapusan, we reiterate our call to the public to stay strictly at home, to maintain social distancing, to observe cough etiquette, frequent hand washing, eating of well-cooked and nutritious foods, having adequate sleep, and perform regular exercise. Mga kaigsuunan, if we work as one, we shall overcome this COVID-19 infection in our country. God bless us all.
Thank you so much, Director Lacuna. Mga igsuon, ang coronavirus or COVID-19 walay gipili. Bisan kinsa pwede matapnan niini. Maong among gihangyo ang tanan na maminaw kita sa mga panghimangno sa gobyerno. Stay at home, stay safe, break the chain, daghang salamat ug maayong adlaw, Caraga.